Talking about GI tract, we have Shelby Yaceczko, who is our advanced practice registered dietitian as a member of our team at the Aggie Hirshberg UCLA Center for Pancreatic Diseases. She's like an invaluable resource. I'm sure many of you in the room know her. She's probably worked with many of you. Whenever anybody asks me if they need enzymes or what they can do to better prepare for surgery, I'm like, Shelby, get in there and figure out how we can better help this person. So I'm really excited to hear her talk today on an update for dietary concerns for pancreatic cancer. Thanks, Shelby.
All right, hello, and I'm looking forward to talking today about how to stay strong through pancreatic cancer treatment and why nutrition and movement matters. And I hope to make this interactive. I realize this is a session right before lunchtime, so I hope some of you become hungry through this session. I feel like that's maybe why they put me right before lunch, but who knows? For those of you who don't know me, I have a nutrition background. I'm a registered dietitian by trade. I also have a degree and a lot of experience in exercise physiology. So my practice, I really enjoy integrating both of these things because I think they're so important and often not talked enough about during some of our clinic appointments or through some of the care continuum. All right. So here's our agenda for today. So we're going to talk a little bit about some common challenges and things that I hear in my practice. We'll talk about why nutrition matters, why movement matters. Hopefully I'll convince you on both, and some adaptation to each person and why that's important. So I was thinking about this. I was actually writing this on the plane recently, and I was thinking about what are the things that I hear most often that people come to me for a visit. Like what are those challenges that people describe? These are the things that I identify as what most often people come and describe to me. That's the first thing I usually ask is, why are you here today? Or what is your biggest challenge you'd identify? And so people will say things like, I feel tired or I feel weak. I have no energy. I've lost a lot of weight. I don't know what to do. I've lost a lot of muscle. I don't have an appetite to even eat. People keep telling me to eat, and I don't want to. I can't. And I can't eat because I have so many symptoms or my side effects don't feel like they're well managed or controlled right now. How many of you can relate to one of these things? Yeah, you're not alone. So kind of diving into our first section of this. So why nutrition matters. And I think it's important just to really, I could have made a whole presentation just on this topic alone. And I'm also very passionate about it too, so I'd love to. But they tell me I've only got 25 minutes, so I'll keep it to one slide and what I think is some of the most highlights in these areas of why nutrition matters. So we know that nutrition supports the whole body, right? It supports just day-to-day function. We can only go so long with being human without eating. So that's important to remember, especially if we're going in and out of the hospital. We have procedures, we're being told we're not allowed to eat for certain periods of time or we have to fast. All of these things accumulate and they add up over time. So nutrition really does provide those basic fundamental blocks that the body needs in order to survive. It also helps us maintain our weight and our skeletal muscle. So we've got our bones, we've got our muscles, we've got all of these things attached that keep up our frames. And nutrition is really those building blocks to help replenish and recover the body so it can stay strong, your frame to stay strong. It also allows us to better fight infections and regulate the immune system and our immune function. It helps us manage or reduce unwanted side effects. So we know that poor nutrition, undernutrition, malnutrition, you've probably heard some of these terms, they actually can further exacerbate side effects or symptoms in many cases, especially during treatment. So that's why it's so important to screen for these things, have these things as part of your care plan if this is something that you are struggling with. Nutrition helps maintain strength or energy levels. It allows for the rebuilding of tissue as well as the rebuilding of the muscle and the frame again, as you will. It helps improve quality of life. So if you've been told you can't eat for 3 days, I joke around sometimes with some of the doctors I've worked with of, you don't eat for 3 days and see how you feel. So it's no different than, if we're going in and out and we've got a lot of procedures or we're preparing for different things during the care trajectory. Some of these periods can really impact the quality of life, especially how we think, how we feel. We're skipping meals. We can feel really tired and fatigued. We can feel grumpy or moody, that hangry feeling you've probably heard. Nutrition also has the ability to optimize treatment outcomes. So we know that individuals who are better nourished, or they've got control, or they've got a care plan in place and they're improving their malnutrition status, they're more likely to tolerate treatment as prescribed with less toxicities. So those are really powerful things to think about. Improved nutrition status also allows for faster recovery from treatment or even a surgery or a procedure to bounce back and recover faster, as well as better prognosis. Again, these are just what I feel like are the main highlights. There's lots more. So some key nutrients for pancreatic cancer, and I kind of broke them down into categories. And instead of really diving into each of one of these things, I wanted people to have some takeaways so they could do some goal setting after this. So if you have a notepad and a pen nearby that you want to take some notes and answer these as we go through, I encourage you to do so, because this is a great way that you can do some goal setting right now too. So first off, lean and plant-based proteins. So I encourage you to think about, what types of proteins do you like to eat? What do you enjoy? We're more likely to eat foods that we enjoy and we're interested in at the time. So if all of a sudden you have a food aversion to chicken, but chicken's on your plate every night, it's not going to go very well. So these are things we really have to think about in the household when we're doing meal planning and preparation, about this being a dynamic process. In going through different cancer treatments or surgery can change the interest in food, the foods we like, the foods that we tolerate. So we need to revisit these questions often. So ask yourself and, take some notes on, what types of protein do you like to eat? Do you have any current food aversions, things that just don't work for you? You're like, that sounds horrible. That used to be my favorite food, but it's not right now. And that's okay. We have to respect that. How often are you consuming protein daily? So we know in order to repair the muscles, to repair the tissue in the muscles, our research really supports we need to have frequent bouts of protein consistently throughout the day, not just at one meal. That's not enough to create what's called anabolism, or muscle protein synthesis, that you'll see in some of the research to help rebuild muscles, especially if we're conditioning for surgery or we're trying to recover from surgery, get through treatment. So we need to have protein frequently, multiple times a day. If anything, I say shoot for at least 3 to 4 times a day to get your serving of protein. And how often do you consume protein if you're exercising, which I'll talk about. So if you don't have an exercise or physical activity regimen, you might after today, hopefully, but also having an appropriate recovery meal after that, so we can give the nutrients the muscles and the body need back after we're breaking them down from the exercise or the training we're doing. So some tips to think about there. Healthy fats. Do you notice fats trigger digestion issues? A lot of you might say yes. And then we dive into more. Well, what types of fats? There's all different types of fats out there. Big buckets are saturated and unsaturated fats. We know usually and typically speaking, most people can tolerate more of an unsaturated fat. So something like olive oil, something like avocados, something like nut butters, some of the plant-focused fats, sometimes better than some of the animal protein fats or animal-based fats or the saturated fats. Especially some of the red meats and processed meats for some people can be a lot more difficult for them to digest and break down and can lead to some symptoms. So we also start breaking down, well, what types of fats are you eating and how much? Can we distribute those in smaller quantities so by the end of the day, your total adds up to a good amount to give you calories and good nutrients? So it's not so much, hey, you gotta eat all of this food at one meal, but how are we distributing it throughout our daytime in our meal pattern? Complex carbs. Does fiber bother you? Some of you might say, I've got to stay on a low fiber diet. Not always true. There's different types of fiber out there. and we know that different types of fiber do different things in the body. We used to say there's just soluble and insoluble, but I could do a whole nother talk on that, and there's lots of fibers and lots of things, viscosity and permeability and all of these different terms that we know that fibers can contribute to. So maybe looking at the types of fibers you're eating and making some adjustments about how we're consuming them, how much we're taking them in, and how we prepare those fibers so you can better tolerate that for gut health. So those are some things to start considering. Are we taking in a lot of simple or complex carbohydrates? I think some of the prior presenters mentioned a couple of things around some of the symptoms that individuals can experience, particularly after surgery and things. So these are important components too, because some of the food that we eat can also worsen or trigger symptoms throughout the cancer continuum. So if we have a big bowl of ice cream versus something like a bowl of yogurt with some blended fruit, that may look very different how we digest, purely potentially because of the types of carbohydrates and the added sugars in some of those recipes or ingredients that we're taking in. So it's also about the types, again, of carbohydrates. Simple being that those are usually more refined or more from an added sugar component, versus complex being more from a whole grain, whole food, less refined component. So for example, we'll go back to simple being something like a pastry, a donut, ice cream, added sugar and coffee, versus something that's more complex like a fruit, a whole grain, a legume, a potato, something that's coming more from a natural or a whole food side of things. So we may need to play around with how and what types of carbohydrates we're taking in so we can get our energy. Are you avoiding carbs entirely? I get that a lot, especially living in Los Angeles. Why? That's my first question is, what's the goal? Like, why are we doing these things? And for some people, it's that they were told by a provider, they were told by a family or a friend, or they saw something online with information from a blog or from Instagram or from TikTok or something. So the first question is identifying, like, why are we doing these things? What's the purpose? And then really going back and seeing from a best practice standpoint and also from your own autonomy of what you're interested or not interested in doing. And how do we disperse out the carbohydrates throughout the day so we have enough energy? Vitamins and minerals. These are all those what I call like micronutrients. We need them in smaller amounts. Do we really have a diet full of colors? Are we eating the whole rainbow? Are we sticking with just green? Because we've been told green is the best. So we've got to look at, whole rainbow, getting in all the different colors, because that's going to give you the whole spectrum of vitamins and minerals your body needs without supplementation, which a lot of people come and say, from this visit, all I want to know is like, give me a list of supplements to take. I get that all the time. And okay, let's dial back. What's the why behind that? Do you have exocrine pancreatic insufficiency? Are we treating you for EPI? That may adjust how well you're absorbing some of your food and may mean that you actually need vitamins or supplements. We may need to look at testing things like the blood levels every year to see where your vitamin levels are at. Hydration. What's your hydration plan? Have you ever been told you're dehydrated? The answer is yes. Let's see if we can play around with your hydration plan. Shift things around in your schedule so we can have a better hydration status by the end of the day, where you're not waking up and having to urinate all night long. So there's ways to, play around with hydration plans too. So these are just some of the common side effects I see from anti-cancer treatments, and this is what's documented in the research, as well as what people come, to me and describe some of their main side effects that can impact nutrition. So we've got loss of appetite, taste or smell changes, nausea, vomiting, diarrhea or constipation, bloating and gas, unintentional weight or muscle loss, fatigue, dry mouth sores, difficulty swallowing, dehydration or electrolyte imbalances. So these things may be popping up. I encourage you to keep a symptom log. I think it can be really helpful for your providers and yourself to identify like when things are coming up for you and if there's any commonality that you tend to see on, days 3 to 5, this is when these things start popping up. Because that allows you to come up with a proactive plan of what to do. And it also allows you to be more informed when you go see your provider, so you can share with them, hey, I realize I've got these trends going. What can I do differently? So that's a really great starter point with your care team too, to keep that log. The reality of our nutrition landscape is still not great. I think it's getting better, but we've got a lot of work to do in this section. So the lack of routine screening procedures around diagnosis means that a significant number of patients at nutritional risk remain undetected, and therefore the opportunity for early intervention for nutritional care, which would be more effective, is lost. Health-related quality of life, overall survival, and treatment-related complications are negatively impacted by malnutrition in cancer patients, which is highly prevalent at diagnosis and affects more than 60% of patients with pancreatic cancer. So these numbers are really kind of in and of itself too, and I think these quotes are really powerful, meaning that we've got to have proactive screening methods for nutritional care, and we need to have a good nutrition care plan in place in order to treat those who have undernutrition or malnutrition, which is really prevalent. Over half of people at some degree will have or be diagnosed with malnutrition during their care continuum. So what do? There's a lot of things. These are some of the main things on the top left. We can focus on eating smaller, more frequent meals, dosing them out, spacing out our nutrients evenly and disperse them. Eating protein first at your mealtime, so you can focus on that to get it in, especially if you're somebody like me who wants to eat the potato at the first part. I have to remind myself, start with some of the protein, so that way my muscles can replenish. Choose easy to digest foods that are gonna make sense for you, that you like. Modify the texture, the temperature of the foods and fluids if you need, especially if you're struggling with things like cold sensitivity. Try oral nutrition supplements. Avoid skipping meals. Have a meal plan in place or a program for yourself. Have a hydration plan. Focus on balanced meal planning. And your eating environment matters. If you're sitting at home and you've got somebody constantly telling you to eat and you're probably like gonna lose your mind at some point, you may need to change your eating environment up. I told somebody this week, I didn't realize they were living in an area that had just snowed. And I said, why don't you go outside on your picnic table and eat? He goes, Shelby, do you want to see my yard? And then showed me, because we were on a virtual visit, it's like like winterland out there. I was like, don't go outside and eat, but go into a different room. But your eating environment can matter. So something to think about, like play music, put a movie on, call a friend on speakerphone. I don't care what you do. But if you're not enjoying your meal, you're less likely to eat. That's just the reality of how we are as humans, right? So who can help me? Consult with a registered dietitian, be evaluated for things like malnutrition, nutrient deficiencies, being screened for diabetes. All these go back to the functions of the pancreas, as well as pancreatic enzyme replacement therapy, or EPI. And find your nutrition champion. If you feel like whoever on your care team isn't supporting nutrition, find someone else that will support nutrition for you, or make sure you've got that support too at home with friends, families, or loved ones that can support your nutrition trajectory. So moving into movement now. So why movement matters. So a couple things from the research that I think are really powerful. This is published directly on the American Cancer Society's website as well. Improved functional status, a positive impact on participation in social environments and human connection, improved quality of life, can help lessen depression and anxiety, improve your muscle strength, your bone health, and range of motion, reduce the feeling of being weak or tired, to help strengthen your immune system, reduce treatment-related side effects, increase your appetite, and help you sleep better. Like, why would you not want to do this, right? I feel like I've convinced you now. So these are some general physical activity recommendations for cancer survivors, and this is from the American Cancer Society that has these on their website, and I can also show you a couple of other resources. So these are just a couple of things to really think about. Taking part in regular physical activity. What does that look like? Where are you starting at? Avoiding these inactivity periods or really considering a slow build up and progression, which you can talk with your healthcare team about how to do that. And really the goal, this sounds like a whole lot. Sometimes I've had people I feel like want to leave the session when I tell them the guidelines. Build up to 150 to 300 minutes of moderate activity each week. And you're like, what? That's a lot of minutes. But there's ways we can do it. And that may be 5 or 10 minutes at a time, a couple times a day. And all those things start accumulating. The goal is that we're doing 10 minutes at a time, which is the minimum. Sometimes I'll do 5 though, if somebody's like, 10's too much. We can start with 5, but really the goal is 10-minute nuggets, and we can have multiple nuggets throughout our day. We want to also include resistance training at least 2 days per week. So it's not enough just to walk. I think we used to say that for a long time, like just go walking, go move around, walk. It's great, that's amazing, but there's also more that can be done to help get the actual clinical benefits from physical activity and exercise, and that includes things like using the muscles, which we may not fully do when we're just walking. So having some type of muscle strength program at least 2 days a week, and doing stretching exercises at least 2 days per week. So I like to think of these things as appointments. So if you've worked with me, I tell you, let's get some physical activity appointments in your calendar to help you stay accountable. These are just as important as your doctor's visits. And these are likely to provide some type of clinical benefit to you over time. The American College of Sports Medicine's ACSM, they have a really wonderful exercises medicine moving through cancer. A lot of great resources to help you get started, videos. They talk about different health professionals that can help get you started if you don't know where to start. They give you the guidelines for caretakers, clinicians, survivors, exercise professionals. They have a lot of downloadables, little videos. So I think this is a really great place to get started if this is a new space for you that you're interested in exploring. I know there's a lot on this slide, but really what I want you to take away is that we have evidence for these things, and evidence, strong evidence in many cases, that exercise and movement of the body can make a difference to people. There's strong evidence that exercise can support cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, and lymphedema, which less pertinent to to this talk today. Moderate evidence around bone health and sleep. And you'll see this is kind of broken down by whether we're doing aerobic or cardio, or we're doing resistance or muscle training. So these, again, they're different types of exercise, and they can have different clinical benefits for you. Really, in my opinion, the best thing to do is really think about the combination of both and how we can make a space for both in our plan. So what's the reality of our current landscape? Although there are many research papers about the benefits of physical activity in cancer, in practice, combining physical activity with treatment is unlikely and rare. I'm sure a lot of you can relate to this, that it's probably not talked about at some of your visits. It may never have been talked about when you went through the health system. In 2020, as many as roughly 36% of cancer survivors aged 18 years and older classify for physical inactivity. Only 7% of cancer patients perform the recommendation for weekly and daily physical activity. It's really low. It's starkly low. So the question is, how do we make this become a reality for each and every one of you to better meet and get closer to that dial to get some of these clinical benefits? So what do we do? With all of that, we're like, what do we do now? So you've got your papers, a couple of questions I want you to think about. How strong are you right now? If you've been to a session with me, I always ask that. How strong do you feel? What would it mean for you to feel stronger? What would that look like? What would you do differently so you could feel stronger? Have you lost muscle? Most of you are like, yes. How do we rebuild your muscle? What could you do differently? Do you have any functional limitations or injuries that need to be discussed? These are critical things we've got to think about before you start a new program. You also need to check in with your doctor and your medical team to make sure it's appropriate for you. Identify where you're at today, right now. Have we started anything, or are we starting from square one and we want to build up? What's your baseline? Start small and set goals. This isn't something you just do overnight. This is something that we progress into. Find a buddy. A lot of people have told me, I don't want to see my friends anymore because digestion is too difficult. I don't like that. Digestion scares me, so I don't want to go to public to a restaurant. Well, can you go walking with them? Can we do something active to still have that social human connection time that doesn't revolve around food because you don't want to look for a bathroom? Understandable. Can we shift gears and do something else though? Who can help me? Consult with a physical therapist, an exercise physiologist, a cancer exercise trainer. Work with your care team to figure out who that resource is going to be for you. Be evaluated for safety considerations and functional limitations, and know your limits. Know what's going to work for you and what's not. So to wrap this all up, some practical strategies. You've got to adapt based on where you're at today and where you want to go. When to rest versus when to move. May look different on treatment weeks versus not. Listen to your body. Know what resources are available to support you. Know what credible, resources are available to support you. Identify who's on your current care team and who you feel is missing. Small, gradual changes can be impactful. I do want to give a shout out to our UCLA health program in our IPU clinic. We started a prehabilitation program that's helping prepare individuals going through a pancreatic surgery, and anyone going through pancreatic surgery qualifies. It's a fully online educational program that helps highlight a lot of these things. We initially called it Prep U for surgery, but UCLA Health told me that it sounded like a bowel prep, like a colonoscopy prep, so we had to rename it recently. It's U Prep for surgery instead of Prep U for surgery. So it's U Prep now, which is great. So we will move the U. But there are resources out there, so I encourage you to really look at those, advocate for yourself, so you can bring in some of these concepts around why nutrition and movement matter. The Hirshberg Foundation does so much great work with some of the social events and some of these events like moving your body at their, participating in different walks and runs. So this is one I just highlighted here. And then, of course, there's a lot of great resources, again, from the nutrition sector with the Hirshberg Foundation on the website that you can also check out, and other archives from other talks that we've done around nutrition. So if I didn't answer your question or touch on a topic today, it may be in one of the archive videos. And thank you so much for your time. I'll open it up to questions.
We're running a little behind, so we want to keep the questions brief. Is there any guidance on removing skins from fruits or veggies prior to consuming to aid in digestion?
Yes, so the skins and things like seeds, skins, those are going to be more of what's called an insoluble fiber, a little bit harder to break down. So if you are struggling with fiber sources or digestion in general, sometimes pulling out the skins of things and just eating the inside, which is more of the soluble fiber, still allow you to consume that. So for example, a tomato, a pear, pitted fruits, you can pull the skin off and see if the inside is a better fit for you.
And what is your opinion about a natural animal fat-based lifestyle? There are several scientific studies and case reports where we see positive results on that kind of lifestyle.
Yeah, I am more of a plant-forward type of hat, so I think the research around cancer care, chronic disease prevention, cancer survivorship, prevention of cancer really supports more of the plant forward, which looks at having majority of our diet come from whole foods and more of a plant focus, fruits, vegetables, nuts, seeds, whole grains, legumes, things like that, with having moderate amounts of animal proteins and limited red meat. So that's more of where my practice lies. I think if you're more interested in having a high animal protein fat diet, I think it's doable, but I always like to go back to ask like the why. Like, why are we doing this, and is there a clinical benefit that we know, and do we feel strongly about it, and we can kind of make it work and see where we can sneak in some plants too.
Hi, my name's Jerry. I'm a 3-year survivor. I just have a quick kind of comment where I know after the Whipple procedure and then definitely during chemo, I didn't have it in me to go exercise or to eat healthy. So I just wanted to say, you know, to the caregivers, like my husband got me to walk around the block every day. So, you know, that's really helpful because when you're in it, you're not thinking, I have to go lift weights. So I just wanted to say that.
Yeah, and it's not easy, right? So having a buddy, having a system in place, having that accountability to yourself. I always tell people the first 2 to 3 weeks is like, why am I doing this? Why did Shelby tell me to do this? But we often see a shift in mindset and a shift in how we're feeling as we start getting some of the clinical benefits from eating the foods that nourish the body, starting to move the body. Once you start feeling better from that over a couple of weeks, you might feel more motivated to do these things and notice the difference when you stop. So a lot of people who start a new physical activity regimen or they start eating certain foods that fuel the body, once they stop doing that or changing course, they may notice they feel more tired, they're sleeping more, they feel less strong. So I encourage you to try it out. It's a lifestyle and see how it goes for you and if we can make some adjustments as we go to meet your needs. But there's a space for nutrition and for movement for everybody in this room. We just have to figure out what that space is.
Thank you. Thank you, Shelby.